Is Dr. Hamel Cothry, the Chief Medical Officer for Dignity Health Central California Division. Thanks so much, Dr. Cothry, for coming in again this morning.
Absolutely, my pleasure.
Okay, so we've been talking about the coronavirus for several weeks now. Of course, it has hit Kern County, and we're less than a week in since we first saw our first cases of the coronavirus here in Kern County. We now have 6 cases, 5 residents, 1 non-resident. Let's first talk about where you think this week is going to go and look like as we continue to test for coronavirus here locally.
So one of the things I think is going to happen is we're going to uncover a lot more positive tests. We have a lot of tests that are still pending, and so those tests are starting to roll in, and that's how we're getting some of these positives. So we should see a lot more positives coming through, unfortunately, this week.
307 pending tests to be exact, according to Public Health. So again, we're talking about hundreds of tests that still need to be getting results for. Let's also talk about something that we unfortunately saw over the weekend up and down the state, and that was people not practicing social distancing. We have been talking about this for weeks now, the importance of social distancing, and we continue to see more cases here in California, in Kern County, and throughout the U.S. This morning, we found out that there are more than 35,000 cases across the U.S., so again, we're talking about this exponential number. What are the consequences for people not practicing this, even though they're not showing any signs of coronavirus?
Well, I think, first off, we have to be responsible, right? We have to be responsible in practicing this social distancing. We also have to hold each other accountable. This is the one thing we know that can prevent spreading of virus. So if you see people that are gathered in groups, I think you stay away from them. If you see people waiting in the line at a grocery store, step back a little bit.
What about, who is this affecting? I mean, we've seen from the beginning, health officials talk about that this is primarily affecting older generations. And you said on Friday that 40% of the people that are in the hospital right now are under the age of 54. Is this virus changing? Is this virus getting stronger in how it impacts people?
It definitely is changing. We didn't see any of this in China. What we saw in China is the people that got sick were all over the age of 65. But here in the U.S., we are seeing it change. We are seeing it affect the younger folks. So there's no immunity to anyone.
Why is that? Why is that? Why is it affecting, as soon as it gets here in the U.S., we're seeing younger people being affected by this more than in other countries. Why is that, do you think?
Viruses tend to mutate as it is anyway, so it's just doing its natural progression.
So it's mutating to be stronger and affecting more people?
Absolutely correct.
So what about, we're in this period where the governor, and actually it's not just our governor, it's governors across the United States we saw this weekend, kind of following California's suit, and doing this self-isolation, stay-at-home policy. LA calls it safer at home. We're kind of in the beginning of this. And we're seeing what's happening in Italy right now. I know that you're also looking at what's happening in Italy. Italy saw its deadliest day on Saturday with nearly 800 deaths. Are we headed that direction?
And I think this is why we're doing what we're doing in this state, for example. We don't want to see that. And yeah, it doesn't make sense. A lot of people are frustrated that they have to stay at home. Schools are closed. A lot of businesses are closed. But this is the way we can stop the spread of the virus.
Do you think we're going to see a lot of changes here this week?
I think so. I really believe so. I think, once again, we have the old cases that still need to be reported, and we're still testing as well. So you should see a rise in the number.
There's been a lot of talk on how long we're going to be in this scenario. We've heard various reports from government officials, from health officials, talking about how long we're going to be in this storm. How long do you think we're going to be in this?
It's so unpredictable. I don't know what this virus is going to do. Most viruses do tend to slow down when the temperatures get hot, and the temperatures go up and there's more humidity. But I don't know what this virus is going to do.
Who are the groups of people that are at risk? For example, there are a lot of people in the U.S. that have diabetes. Is that a group of people that could be more at risk with this virus? Or are there other people that could be more at risk?
So what we're saying is anyone that has a lowered immune system, so diabetics, they tend to have a lowered immune system. People that are older obviously have a lowered immune system. If you're actively undergoing chemotherapy, all those people at higher risk. Once again, in our community, we talk about valley fever. If you've had valley fever and you have scarring of the lungs, yeah, you are potentially at higher risk. People that have COPD that have smoked, they're at higher risk as well.
If someone has this virus and recovers, can they get it again, or are they immune from catching it again?
Well, the virus is going to change, so they may not get this version.
Okay.
But they will get it down the road. This virus may go
flu?
Very similar to the flu, correct.
In the sense of the strain can change, from year to year?
Absolutely correct.
And do you think that this is something that we could deal with for the foreseeable future, where it might die down in the coming months, but we could see it come back and we're just going to have to deal with this?
I believe so. And, if you look around the world, everyone's looking for a vaccine right now. They're looking for treatment. So I don't think this is going away. It will go down, but yeah, you're absolutely right. It will come back up again next year.
I want to go back to social distancing for just a little bit. And one of the things that, in these stay-at-home, self-isolation orders that are taking place across the U.S., one of the things that government officials and even health officials stress is essential businesses are still open. You can still go to the grocery store. You can still get meals at restaurants if it is takeout or delivery. The concern, though, is that if someone is in these establishments, if you go to, let's say, a fast food restaurant, for example, and someone is making your food and they have coronavirus, even though they might not be showing symptoms, can they pass that to you? Is there a concern there, even when essential businesses are open?
So the biggest thing is we've got to make sure that these healthcare or these workers are washing their hands, because that is the way we transmit this virus. So if they've washed their hands, as long as they're not coughing on your food, then the chance is very low. But if they haven't washed their hands after they've coughed in their hands, yes, you can get the coronavirus.
Is that something that, do you believe, establishments are taking seriously? Do you think that there are businesses that have stepped up and ramped up cleanliness in order to prevent this, or is it hard to tell?
I would like to think they have, but unfortunately there's no way of auditing that.
What about people who are, again, does this kind of apply for people who are using a service like Restaurant Runner here locally, who are waiving fees? Does that also apply to those people who are utilizing that service and delivering the food and leaving it maybe on the front step?
Yes. So once again, this virus can stay on cardboard, it can stay on plastic. So what I've told people is, as soon as you take the food out, wash your hands. Keep your hands washed. And that's as simple as that.
As we again, start this new week, and I feel like a lot of people are kind of putting on their seatbelts and just waiting to see what happens. What is the advice that you want to give to people as they continue to kind of watch this and not know what the future holds?
So, the biggest advice would be, be safe, take care of your family, keep your hands washed, keep them away from your face. And also, I think in these trying times, we've got to come together. We've got to come together not only as a community, but we've got to come together as a state and as a nation. And I really hope that all of us get together and we take care of this virus.
All right, well, Dr. Cothry, again, we want to say thank you for coming in this morning, but we also want to just say thank you to all of the first responders and the medical teams across the U.S. and the world that are working 7 days a week, tirelessly, trying to put a stop at this and trying to contain it. So again, thank you for your service, and thank you to all of those in the medical field who are trying to, put a stop to this virus. Again, thanks so much, and we'll see you tomorrow morning.
Absolutely.
All right.